Each year, the 14th of November marks World Diabetes Day. Now, the number of people living with diabetes is rapidly rising, and by 2040, it's estimated that 1 in 10 adults globally will be affected by the condition. 1 in 10 people. The main causes of the diabetes epidemic are increasingly sedentary lifestyles and the widespread availability of foods that are high in calories but low in nutrients, energy dense but without the adequate nutrition, foods that perhaps we all crave but none of us really need. There are close links, as you know, between diabetes and heart health. In fact, adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without diabetes. The same applies to strokes. Now, this makes a healthy, balanced diet critical on 2 levels: to prevent or delay the onset of diabetes, and of course to manage it once it's started, and also to reduce the risk of later developing cardiovascular problems. For a heart-healthy diet, we should avoid foods that contain high levels of trans fats, including partially hydrogenated oils, avoiding saturated fats and, of course, excess sugars, starches and carbohydrates. Instead, it's recommended that we eat foods that are high in key nutrients, including the essential omega-3 fatty acids, EPA, and DHA, as well as vitamins C, D, and E. If you're a physician, talk to your patients about taking a preventative approach to cardiovascular health throughout life, starting from childhood. And if you're a patient, be sure to speak to your healthcare practitioner before incorporating a dietary supplement into your routine. I always think a much more accurate, tailored approach that suits you and your personal needs is much better than a catch-all approach where you're taking things you don't really require and could cost you money you can't really afford.